Imagine getting sick and skipping the doctor because you think it will cost you thousands. But what if I told you that you might be leaving free money on the table every single month? Money that could help pay for your health insurance. Today, we are breaking down health insurance subsidies in a way that is simple, clear, and packed with examples you can actually relate to. By the end, you will not only understand how subsidies work, but also how to know if you qualify. And the secret mistake many people make that causes them to lose out on hundreds of dollars. Stick around, because that mistake is something you will definitely want to avoid. Number 1. What exactly is a health insurance subsidy? Let's start with the basics. A health insurance subsidy is financial help from the government to make your health insurance more affordable. Think of it like a coupon that reduces the price of your monthly premium or helps cover your out-of-pocket costs. 4. Example: imagine a family that would normally pay $800 a month for health insurance. With a subsidy, their cost might drop to $300. That is a $500 difference every month. Over a year, that is $6,000 saved. That is not small change. That is vacation money, emergency savings, or a big chunk of debt paid off. Number 2. Where do these subsidies come from? These subsidies come from the Affordable Care Act, often called the ACA or Obamacare. They are provided through the health insurance marketplace. If you buy health insurance through your job, you usually do not qualify for subsidies. But if you buy insurance on your own through the marketplace, this is where the subsidies come into play. Here is an example. Let's say John is self-employed and buys his insurance on healthcare.gov. Because his income is modest, he qualifies for a subsidy that cuts his premiums in half. His friend Sarah, who gets insurance through her job, does not get a subsidy. Why? Because her job already shares the cost of her insurance. Number 3. The 2 types of subsidies you need to know about. There are 2 main types. The first is called the premium tax credit. This helps lower your monthly payment for insurance. The second is called cost-sharing reductions. These lower the cost you pay when you actually go to the doctor, like deductibles and copayments. Here is an example. Imagine you go to the doctor, and without cost-sharing reductions, you owe $50 for a visit. With the subsidy, you might only owe $20. That difference adds up fast if you need frequent care. Number 4. How do you qualify for a subsidy? This is the part most people find confusing, but I will break it down step by step. Subsidies are based mainly on your household income and family size. The government compares your income to something called the federal poverty level. For example, in 2025, if you are a single person making around $30,000 a year, you might qualify for help. If you are a family of 4 making around $60,000, you could also qualify. The key is that your income cannot be too high, but it also does not have to be extremely low. Many middle-class families still qualify. Number 5. The sliding scale of subsidies. Subsidies work on a sliding scale. This means the less you earn, the more help you get. The more you earn, the less help you get, until eventually you no longer qualify. Think of it like a dimmer switch. At the lowest incomes, the light is bright because the help is big. As your income rises, the light dims until eventually it turns off. For example, someone earning $25,000 a year might only pay $100 per month for a plan that would normally cost $600. Someone earning $80,000 might get only a small discount, paying $500 instead of $600. Number 6. What is the marketplace and why does it matter? The health insurance marketplace is the official place to shop for subsidized health insurance. The federal one is healthcare.gov, but many states run their own. When you apply, the marketplace automatically calculates your subsidy based on the information you provide. Imagine it like shopping on Amazon. You see the full price of the product, but then you see the discount applied at checkout. That is exactly how subsidies work on the marketplace. Number 7. Advance payments versus tax time surprises. Here is something most beginners do not realize. Subsidies can be paid in advance every month to lower your premium, or you can claim them later at tax time. Let's say you qualify for a subsidy worth $400 per month. You can choose to have that $400 applied right away, so your bill is cheaper each month. Or you can pay full price during the year and get a refund of $4,800 when you file your taxes. But be careful. If your income changes and you end up making more than expected, you may owe back some of the subsidy at tax time. Number 8. The big mistake people make. Here is the mistake I mentioned earlier that costs people hundreds or even thousands. Many people do not update their income when it changes. For example, let's say at the start of the year, you earn $40,000 and qualify for a subsidy. But mid-year, you get a new job and now you are making $60,000. If you do not update your marketplace account, the system will keep giving you the bigger subsidy. At tax time, you will have to pay back the extra help you were not actually entitled to. That is why it is crucial to update your account whenever your income or household size changes. Number 9. Special cases and exceptions. There are some unique cases that are worth knowing. If your employer offers insurance, but it is considered unaffordable, you may still qualify for subsidies. Also, if you recently lost job-based coverage, moved to a new state, or had a major life event like marriage or a baby, you may qualify for a special enrollment period to get subsidized insurance outside of the usual open enrollment window. For example, Maria lost her job in June. Because of that, she was allowed to sign up for a marketplace plan with subsidies, even though the normal enrollment period had ended. Number 10. How subsidies actually change lives. Let's make this real. Without subsidies, many families would be uninsured. A survey showed that over 80% of people enrolled through the marketplace receive some form of financial help. That means millions of Americans are paying hundreds less each month. For example, a friend of mine who works freelance was quoted over $700 a month for health insurance. With subsidies, her cost dropped to just $120. That difference allowed her to keep her business running without going broke paying for insurance. Number 11. How to check if you qualify today. The best way to know is simple. Go to healthcare.gov or your state's marketplace and fill out the application. It will ask for your income and household details and instantly show you what help you qualify for. Even if you think you earn too much, check anyway. Many middle-class families are surprised to find out they qualify. Number 12. Why subsidies matter for everyone. Here is the bigger picture. Subsidies are not just about saving money on your own insurance. They also reduce the number of uninsured people in the country. That helps keep hospitals and clinics running smoothly and lowers overall healthcare costs for everyone. Think of it like car insurance. If everyone has it, costs are spread out and risks are managed better. If too many people go without, the system gets more expensive for the rest of us. Number 13. Thoughts you cannot ignore. Health insurance subsidies are not just for the very poor. They are for everyday people, workers, families, freelancers, retirees who are not yet old enough for Medicare. The key takeaways are simple. Subsidies can lower your monthly bill and your out-of-pocket costs. Your eligibility depends on income and family size. The marketplace automatically calculates your help. And the biggest trap to avoid is forgetting to update your account when your income changes. Number 14. The difference between bronze, silver, gold, and platinum plans. Many beginners get confused when they see these metal tiers in the marketplace. The subsidy amount does not depend on which plan you choose, but it is tied to the cost of a benchmark silver plan. For example, if the benchmark silver plan costs $500 and you qualify for a $300 subsidy, you can apply that subsidy to any plan. If you choose a bronze plan that costs $400, your final premium might only be $100. If you choose a gold plan that costs $600, your premium would be $300 after the same subsidy. This gives you flexibility to pick the plan that works best for your health and budget needs. Number 15. Can immigrants qualify for subsidies? Yes, many lawfully present immigrants can qualify for marketplace subsidies. As long as you are legally residing in the USA and meet income requirements, you may be eligible. For example, someone with a green card or on certain visas may still qualify. However, undocumented immigrants are not eligible for subsidies through the marketplace. This is important because many immigrant families do not realize that financial help is available to them. Number 16. Subsidies and Medicaid. How they connect. In some states, if your income is too low, you may not qualify for subsidies because you may qualify for Medicaid instead. Medicaid is separate from marketplace subsidies but serves the same goal, making healthcare affordable. For example, a single parent earning $15,000 in a state that expanded Medicaid would likely qualify for Medicaid. In a state that did not expand Medicaid, that same parent might fall into what is called the coverage gap and not qualify for either. This is why where you live matters when it comes to health coverage. Number 17. Age and how it affects subsidies. Your age impacts the cost of health insurance, but subsidies adjust to cover the difference. Older adults often face higher premiums, but the subsidy grows with the cost to keep coverage affordable. For example, a 60-year-old might face a plan costing $1,000 a month. With subsidies, they may pay only $200. A younger person with the same income might face a plan costing $400, with a smaller subsidy making it $150. This ensures affordability across age groups. Number 18. Why reporting family size matters. Subsidies are based not just on income, but also on how many people are in your household. Family size includes yourself, your spouse if married, and anyone you claim as a tax dependent. For example, if you are single making $40,000, you may get a small subsidy. But if you are married with 2 kids and making the same $40,000 as a household, your subsidy could be much bigger. Reporting your correct family size makes a huge difference in how much help you get. Number 19. Seasonal or freelance workers and subsidies. If you have fluctuating income because you are a freelancer or seasonal worker, you can still qualify for subsidies. You estimate your annual income, and the marketplace uses that estimate to calculate your subsidy. For example, a landscaper might earn more in the summer and less in the winter. They still qualify as long as their total yearly income is within the eligibility range. This flexibility is key for gig workers and entrepreneurs who do not have steady paychecks. Number 20. What happens if you do not use subsidies? Even if you qualify for subsidies, you are not required to use them. Some people choose to pay full price during the year and collect the credit later at tax time. Others may simply not apply for help. For example, someone who expects a big jump in income later in the year might avoid using subsidies upfront to prevent owing money back. But for most people, applying the subsidy each month makes health insurance affordable right away. So what about you? If you had an extra $400 or $500 each month thanks to subsidies, what would you do with it? Would you save it, invest it, or finally take that trip you have been dreaming about? Let me know in the comments below.